Hello everyone. So today we are going to see about the unit which is taken from genetics. So here the major topic is genetic testing for neonates and children. And in depth we are going to see about screening for neonates and children. So as you can see from the picture that there is an infant and neonate who are lying on the left side, and on the other side the genetic testing tubes which is being taken sample from those neonatal children, and we analyze those samples to find out what is the congenital deformity. So coming to the introductory part, neonates are children who are born from 0 to 28 days of life, and children will be coined like after 1 year till 19 years of life, that is till the adolescent period. Genetic testing, when you coin what is genetic testing is, it is mainly to identify the genetic differences or susceptibility to particular diseases or abnormalities. So here in neonatal testing, we'll be confirming about all the neonatal associated disorders in the neonatal period. So here the quality of life is mainly impacted positively with early detection, and the cost to society is being reduced, as well as it may need less extraordinary services. Other tests such as we can find out by using finding out the chromosomal abnormalities such as trisomy 13 and trisomy 21. So here this genetic testing plays a major role to find out all the sorts of trisomy changes in the chromosomal abnormality such as trisomy 13 and 21. So in this picture you can see that the trisomy 13 is a disorder where the child's head is very small with the ears being low. So that is when you draw an imaginary line from the outer canthus of the eye, the targets of the ear are very low, and associated defects are also being present in both the conditions. In trisomy 13, the baby will be having cleft lip or cleft palate, and in trisomy 21, baby can be showing off some mental retardation as well. So, coming to the meaning of neonatal and children testing. So, genetic testing is mainly targeted, or you can do it for a general population. So, the targeted population might be neonates or the children itself. So, here we will be screening all the children who are at risk. Might be history of family or any person who is showing the signs and symptoms of congenital, or might be this genetic deformity. So, genetic testing here defines the analysis of the human DNA, RNA, and chromosomes abnormalities, where we can screen it by just doing it from either intrauterine life or even in the extrauterine life. So, here the detecting and diagnosing of a present disease, and you can do this genetic testing to find out who is are in the carrier state, as well as also we can find out whether it is the clients are being having this changes in the genetic defect, whether they are highly susceptible, and we can identify, as I told you, in utero itself, in the mother's womb itself, we can identify whether the child is going to be born with that defect. So here, coming to the newborn screening, so the common test performed here to identify phenylketonuria or mental retardation. The common test here used is tandem mass spectrometry. Expansion of molecular or DNA based testing can be performed. And here they are using the oldest technology, which is like placing the filter paper and dry the that particular sample, and they will be finding out how much is the bacterial load, and thereby they estimate the changes in the genetic material by using the sample of the capillary sample of the infant or neonate. So here, what are the elements very essential in newborn is that new neonates are to be tested before hospital discharge, or might be we can also plan for in hospital babies as well as who are born outside, might be in a maternity center or at homes, or might be in remote villages as well. Here we'll be educating the parents regarding the main purpose of why the particular genetic testing is being convinced. And the common disorders screened by using genetic testing is phenylketonuria, congenital hypothyroidism, galactosemia, hypocystinuria, maple syrup urine disease, hemoglobinopathies, sickle cell disease, congenital adrenal hyperplasia, cystic fibrosis, congenital hearing loss, and diabetes. So, most of the diseases, when you compare, it is having mostly on the metabolic aspects when compared to the congenital aspects. So, here genetic testing also have, according to the American Society of Human Genetics, they have been divided this approach into four major criteria. One is that immediate treatment and surveillance to the affected child. The second one is that testing to define reproductive risks, such as asymptomatic carriers can be screened, the mother and the father. Predisposing to develop a disease, that is, any healthy person may develop a disease in the later stage, will develop a disease in the fourth approach is that healthy young person will be screened earlier. So the first category of clients would be like the testing will be aiding them to find out what is the benefit of the treatment. Like for example, multiple endocrine neoplasia, mainly a pre-malignant adenomatous polyps in the colon or in the GI tract or either in the brain and thyroid. So colonic visualization at the age of 2, and they can be easily treated with surgeries. So it is actually going in the preventive aspects rather than going for any other major complication. The second category of testing would be like testing for the future. Like for example, what are the challenges? What will harm the patient? What if the parents are requesting at the age of 14 they wanted to find out what is the problem with the child, or might be they would also plan in for if, for example, if that particular family had death of any siblings, so those history also would be collected and it can be considered as a form of carrier state. And here parent child bonding also will alter, and this causes changes in the self concept and self realization as well. And the last two category will be category 3 and 4. Here testing will be done in the absence of medical benefits. Like for example, whether to provide this genetic testing becomes increasingly complex. Like, for example, an individual is being at risk for developing breast cancer. So, we can screen in for BRAC 1 and 2. And those who are being high risk for developing colon cancer, they can be screened for HPCC. Other factors such as modifying gene, environmental influences, and the other nature concepts should be screened well. So the last but not the least would be qualities of ideal screening testing must be very rapid. It should be very inexpensive, very simple and sensitive. Whoever the local people also can go and get it benefited. It should be specific, safe, and it should be always accepted. And it should have a validity. Like you cannot go and charge all the client to do the genetic counseling. So whoever needs, they can go and get tested, and it can be done. So coming to the summary, so genetic testing and screening of a neonate is early detection of chromosomal or a DNA or protein changes which can cause a predisposed disease. So there is also we can find out who are the persons at risk or who are the persons who may be acting as a carrier and transmit the disease or disorders to the offspring. So, coming to the conclusion, the reason is genetic screening is to detect the genetic carrier status has become the mainstay of current practice and can be easily done by a variety of deduction techniques. So, last but not the least, you should be at the end of this session. I hope so that you will be able to define what is genetic testing, list down the possible congenital screening test, explain the categories of screening test, as well as describe the qualities of ideal screening test for genetic disorders. So you can see these are the common references which I have used for genetics. Suresh K. Sharma's books and Banson's textbook of pathology and genetics, as well as Saitara and Sonal Sharma. So I hope you all enjoy the video, and don't forget to like, subscribe, and comment. So if you have any doubts, please put in your queries under the comment box. Thank you all. Have a nice day. Thank you.